Hello, and welcome to the Media Center's 9th Local Hero Awards series, in which we showcase 5 people from the Mid-Peninsula for outstanding achievement or contribution to the community. We solicited nominations and were especially looking for the unsung heroes. Each winner is an inspiration, and each has a great story to tell. When you think of the needy in our community, the groups that probably come to mind are the homeless, drug addicts, the mentally ill, maybe people who are all three, and yet these tend to be the very ones for whom resources are the hardest to come by. Generally, aid workers are not lining up to help them. One person who is helping them, quite literally around the clock, is Ty Deldridge. Ty is a healthcare manager at the Ravenswood Family Health Center, where she links homeless patients to behavioral health counseling and medical and dental services. She also sits on various boards at the city and county levels, advocating for the homeless. But what may be most important and most unusual about Ty is her personal interest in the people she serves. She seems to have an instinctive compassion that won't let her stop giving, day and night, in any way she can. You're most likely to find her on the streets of East Palo Alto, just being there for the people she knows need her the most.
But that's somebody we can always count on to come out here no matter what, if it's cold, whatever. I didn't have a coat. I lost all my stuff because it was stolen out of my storage. She brought me all the way to the office. She gave me a coat, blanket. She's always out here. She make sure we keep our hygienes up in our mouth, and we're warm because she sees us out here every day struggling.
Ty, the population that you work with tends to be an untrusting group of people, but they trust you. Why?
Well, Louise, I believe they trust me because after the years, I've grown and built up a good relationship with them. When I first started this job, of course, they didn't know me from anybody besides I was the little girl who grew up and some knew me, and now I'm grown. And they're like, aren't you such and such daughter? So just building up a relationship with that population was really, really important for me to do my job.
What about your own experience? I gather a lot comes from your own family and what you grew up with, which allows people to feel comfortable with you. Tell me about what you grew up with.
So as a child, I grew up with a family heavily addicted to drugs. So I had a number of family members that I lived with that were addicted to drugs. So being in the midst of that, you see so much that I believe as a child you should not have to see or live through. So me working with this population, I can relate to them, especially if they have children and they're on the streets and they left their children with the grandmothers or the aunts or someone. I can relate to them how important it is for them to get their life together. It's never too late to get their life together, to get their children back, or to reunite with their family that they're distant from because of the addiction. You lose a lot of time when you have family members that are addicted to drugs. They're in jail a lot and different things where you don't get to see them. You miss a lot of family activities when the addiction overrules their life.
How old were you? Do you remember a moment when you first got it and you realized what was going on?
I think I was about 9. I was about 9 when I myself made the choice that I didn't want to be around that anymore. I wanted to, unquote, be a normal kid.
When did it sink in that things were not normal? Or how? What do you remember?
Just growing up with, I always lived with my mom when I was young. I always stayed with my mother. But her addiction kind of took over parenting, kind of say. So people in and out or going from different places and just seeing all the drug trafficking and different things. One day I just say, I want to live with my grandmother because I felt my grandmother's house was a place of normal. Like she cooked there wasn't people in and out all day. You went to school, she went to work. You come. I just wanted to be normal. I didn't want to deal with the extras.
So for people who really don't grasp what it must have been like, what was the not normal, a day in the life that you had to go through?
Not having my biological father around, my mother missing, she would go away or go to jail, and just not having her on those days is, kind of, you see your friends who have a mother and father, and you always wonder in the back of your head, how is that life to have a mom and dad, raising you together? Because I used to hear my friends say all the time, my mom said no, but my dad said yeah. Those kind of things. For me, I didn't have that that privilege as a child to have mom and dad to raise me, or we did family things. But I was lucky enough to get a stepfather who helped my mom to do some fun activities and help me, when she was clean. But then when her addiction overwhelmed her life, I back with my grandmother. So
Was there a day and night difference between when she was clean and when she was addicted?
oh yes, when my mom kept a job, she always loved taking care of the elderly, even during her addiction until she just hit rock bottom. But she kept a job, and I remember her going to work, and I remember her being okay sometimes. But it was just sometimes she just couldn't control her life. What I call now functional addicts. I have a lot of functional addicts. At some point, I believe she couldn't be functional anymore.
Were you there to witness that? What does it look like when somebody hits bottom?
It's really bad. You're kind of embarrassed because, as a child, just you see your mom walking down the street and you're like, oh my God, that's my mom. And you want to love your mom, and you want to, but you with your friends, so you're embarrassed, so you cross the street or run. So, I mean, I don't think anybody should have those memories, but I do. But when she hit rock bottom, my mom disappeared. I thought she was back in jail, and she just disappeared. But come find out, she hit rock bottom, and she got tired. She put herself in a program. And she put herself in a program. We found out later where she was. My grandmother and them did research and found her in a drug treatment program. Wow. So, and I think now, just being in the medical field with the treatment programs, a lot of clients tell me, when you're tired, you're tired. And you have to be tired. No one else for you. Mm-hmm. You have to be tired. And that's when you will seek help, and the help will work. Yeah.
I want to talk more about what you do in a minute. But just to go back to, I'm trying to think of being a child in your shoes. You talk about being embarrassed. Was there a fear?
Yeah. You see a lot of people overdose. A lot of people died from drug addiction where I lived. A lot of people, family members and uncles, overdose was what happened. Yeah.
And did that didn't make you okay with it?
No, it made you afraid, because what if that happened to your loved one? And then they won't be there, and then they didn't really have a chance to get their life back together. So that was a fear all the time, especially if you hear the ambulance come and everyone's standing around somebody OD'd, and it's like, wow. And again, that was normal for me. It wasn't a shocker to hear that somebody OD'd.
But each time it was a shocker, I would guess, on some level.
Sometime, but you get numb to certain things. I think you start to try to block things out, so you won't, because if so, it'll take, I think for me, it would have took most of my life. I would have been so depressed and sad. But I learned how to flip it and just pray and, see life differently.
So now let's talk about that. You lived with your grandmother. Mm-hmm. What was the secret for you? What worked?
To live with, once I moved with my grandmother, my grandmother, a very loving person. She was strict. You had to go to school, clean up, everything, but it was structure. So it was just, for me, I felt like it was home. She raised me and my cousins. It wasn't just me, so You think about if people take time out of their life to raise a second set of kids, they're pretty special people because they've already raised theirs, now they're raising more.
It sounds like, too, that you had a real sense of community. How important is that, the village raising the child?
Very important. For me, a lot of us, once like the the heroin and the crack hit East Palo Alto, a lot of my friends, I maybe had like 2 or 3 sets that had a mom and dad. The rest of us were raised by our grandmothers. We all lived with our grandmothers, so even to this day, we relate to that. How such and such grandmother would keep these kids while mom had to go to work, or you always had a place to go eat because someone cooked a big pot of spaghetti for all the kids because, you know, we kind of they looked out for each other because the community was raising these kids. Everyone knew where you were. There was no cell phones back then, but my grandmother knew where we were and we knew what time to be home. I mean, if I was somewhere I wasn't supposed to be, she would know before I got home. Someone would make that call because it was a village raising us.
Yeah, huge safety net. So I'd like to talk about 2 areas that you specialize in that there's a huge overlap in, and it's artificial to separate them, but I would still like to talk about them separately: addiction and homelessness, because I understand a lot of the homeless are addicted and a lot of the addicted are homeless. Starting with addiction, how many people actually do get clean, and what fraction relapse?
Well, we have some relapse rate in our treatment programs, but like I said, just knowing that community now that I've been doing it and speaking with them and building a relationship with them, if they're not ready, they're going to relapse. If parole makes them go and say, if you don't go to a treatment program, I'm going to send you back to jail, that doesn't work. Because as soon as they finish their 6 months in treatment, they're back out. You know, they have now a good relationship with the parole officer, so now they go back out. So it just has to be something in their life, a little light that comes on and say, I'm tired. I don't want to do this anymore. And then they also have to remember that it's hard. You didn't become this addicted overnight. So it takes day by day, hour by hour, in order for them to get back to, unquote, what we call normal. And that's not being addicted to drugs and alcohol.
And what can you do to help?
I'm always there for my clients, always, no matter what, even if they relapse. My thing is, living in East Palo Alto, I see a lot of my clients in the stores and on the streets, and if they see me, sometimes they duck, and I tell them, don't hide from me. And then one, you know, or a few will say, well, I used last night, but today is a different day, is what I tell them. Start over. If you used an hour ago, it's a new hour. Start over now. So I never judge them, never. I don't know what walk of life they came from, what made them go to drugs. I can't judge them. I don't know what they went through. Their struggle is different from my struggle, but I just, you know, once they're ready, and I'm there for them to get them into detox, drug treatment, reunification with their children to start the process. Whatever they need, I'm there for them, no matter if they used an hour ago, a minute ago. You know, it's always, you know, hope.
So you must have witnessed, at least on a few occasions, success.
Oh, yes.
Tell me about that.
That's what keeps me going. I've had people who've relapsed over and over, or people who have lived in the streets for years, and then they get into a drug treatment program, and they come back to me and say, Ty, I have my own place, I have a job, I have my car. Or the best ones for me, because growing up as a child with a parent addicted to drugs, when they tell me they got their kids back, they are living that, unquote, half normal life. They have bills, they're coping, they're taking care of their kids, going to teacher conferences. It's like, wow. And it makes my heart just like, oh my, I just want to jump for joy, because it's a blessing. It's like, oh my God, I got the kids back. The kids want to be with the mom, and I know they do. Or the dads who haven't seen their kids in 5 or 10 years. I see my kid, you know, and I spend time with my kids on the weekends. It's a wonderful thing. So that pushes me to continue.
Do you feel kind of happy twice, once for them and in a way once for you from your past?
Yes. Just always, family means the world to me. So to see others, to you know, reunite with their families. I don't care if it's a cousin on the father's fifth side, because they always come in homeless and say, I don't have any family. I don't have any emergency contact. And they'll come in and say, I found my grandmother's sister. That's wonderful. Family is important. And they, in the homeless population, they distance themselves from their family for a number of reasons. So for that, reunification is wonderful.
Well, so let's talk about the homeless now. Tell me, already you said they distance themselves. What is it? Tell me things about the homeless population that a lot of people just might not understand or be surprised about.
A lot of them, the mental health, they have a lot of mental health issues. So dual diagnosis, what we call it. So you have homeless, and then they're addicted to drugs or alcohol, and then the mental health is not as stable, or depression, different things, because you never know what brought them to that point. So we tend to judge that they're all just drug addicts, but these are drug addicts with problems, or they could be homeless and not on drugs. May look like it, but they may not be on drugs. They just hit rock bottom. So I just think that it kind of goes hand in hand, homelessness. Even if a person is not homeless and they're staying in an encampment, there's a lot of drug use and so forth. So it's just, I think, a way of life that they have adapted over the years.
Do you ever get scared?
Not really. No, I don't. I'm not scared. I go into the encampments. Like my mom say, I just stay prayed up. And I have a good relationship. When I come, you can hear them saying, "Tide's coming." You know, I mean no harm, and if you don't want me there, that's fine. And if you do, you do. And they always know that I'm there to help if whatever they need. You know, if I can be an advocate for them, that I will.
So few and far between are your successes. So much of the time must be failures.
Yes.
Do you ever get discouraged?
I don't, because of that success story that I've had over the years. So I can put a person in detox in 1 month 3 times. They come to me and say, I want to go to detox. And I continue to get them a bed and do all the footwork to get them in. And then the next day I see them at the bus stop. But I don't get discouraged or sad. You know, I just said that wasn't the day. And next week might be the day. So I'll do it again next week. Just keep pushing forward, and one day that might be the day, and they come back and they're clean through the programs, you know, doing well.
How important is the whole concept of hope for them and for you?
Hope is like one of the biggest, and one of those words that just keeps you going, because without hope, what do we have? I hope and pray every day for the homeless that we can end homelessness and get treatment, more treatment programs, more parole reentry guidance for the parolees so they won't be back homeless or be back on drugs. I just hope every day that the world changes where we can help others, give a helping hand up instead of judging.
And how important is it for them to pick up that hope from you?
For us to stay positive and don't judge. It's important for us to not assume with the homeless. Always ask, how can you help? And just, you know, think better, you know. I can't stress enough, just don't judge them, because once you sit down and talk to them, they're amazing people. They come from, a lot of them are educated, different walks of life. Some of them traveled. I mean, I've learned so much from them.
So speaking of amazing people, I want to circle back around and hear the last or the up-to-date chapter about your mother.
So my mother is doing really well. It's my best friend. We just came back from New Orleans, and I love hanging out with her. She's the best grandmother in the world. My kids love her. I spend a lot of time with her. I don't know what I would do without her, because I believe God cleaned her up right as I needed her, because I was 17 and pregnant, and she got clean the same year and been clean since. And I needed her because I was 17 and still in school. I needed someone to watch the baby. She was clean and able to work at night and watch the baby in the day. So it all worked out. I mean, it's like God's plan. We're not supposed to question it, right? And I'm thankful every day for her. She's an amazing person, strong.
So speaking of plans and visions, both for your work, but maybe even for yourself and your community, what's your dream?
My dream is to open up a respite care in San Mateo County, preferably in East Palo Alto. Respite care is when the homeless go to the hospital, like you and I will go to the hospital, have a minor surgery or major surgery. Our family takes care of us. We have a place to rest, to recuperate. They don't have that here. Our shelter in East Palo Alto is just a day shelter. It's it's just a night shelter. It's not all day. So they're closed. They have to leave at 7 in the morning. With a respite care, they can stay there all day. No nurses. Nurses may come in once or twice, but they learn how to take care of themselves and heal properly. That's my goal. My dream is to open up a respite care. If I hit the lottery today, that's what I'm going to do.
I love it. Well, best of luck to you with that and with everything else. That we're out of time. So thank you very much and congratulations.
Thank you.
Do you know someone who has overcome significant hardship and has an inspiring story to tell? Someone who has sacrificed or given over and above to the community and deserves some recognition? If so, please contact us with your nomination for next year's Local Hero Awards. To find out more about our local heroes and to watch interviews with all the winners, visit our website, midpennmedia.org. At the Mid-Penn Media Center, you can make your own videos and television programs and take classes in all aspects of media production. You can also hire our professional services team. To find out more about that, go to mcproservices.com. Congratulations to all our winners, and thank you for watching.